Hey, it's Dr. Charles Weigel, and in this stretch we're going to be working on the muscle of the sole that goes through the pelvis and the lower back. It can create a lot of issues right across the belt line into the lower back. A lot of times we get a lot of tightness in the front of their hips here. It's a really common issue a lot of people have, especially if we sit a long time, because the movement of this muscle is to bring your knee up towards your chest like this. So if we're sitting that way for a while, that muscle's going to tighten. We call it the muscle of the sole. It's called the psoas muscle because it's actually the muscle that goes from the front of the pelvis or the front of the hip, goes through your body and into your spine there. So it actually goes through the pelvis and into the spine. An easy way to stretch that, or a not so easy way to stretch that, is we got to get the knee to go backwards behind the hip and the pelvis there. So one of the ways that we do it, I'm going to turn sideways so you can see here, is you get your knees in this position. You're going to keep your back leg straight, and you're going to bend your front knee and almost doing like a modified squatting position here. Most important part with this stretch is keeping your knee back and straight, the one that's back, and bending the front knee, almost like you're trying to push your hips and your pelvis out in front of you. So it looks like this from the side here. As you're doing that stretch, you should feel that tightness or that tension right in your front pocket, almost if you stuck your hand right in that upper portion of your front pocket, right inside the points of your hips that your belt hangs on. That's where we want to focus on feeling that stretch. Now you might have to just slightly turn or modify. Try not to turn too far, but find it so it hits right on that spot. That's the muscle we want to focus on stretching. You might even feel it pull in your lower back, and that's okay. Same with this stretch, along with all the other ones, is making sure that you're feeling it in that spot and not overdoing it. Take it just to the point where you feel that stretch, and you're going to hold that position for about 20 to 30 seconds. You're just going to kind of almost sit on it, let your pelvis lean forward just a bit, or almost like you're trying to lean back. If you lean forward, you're going to lose that stretch. So we want to keep our chest up high and let our pelvis run forward there. And then we're going to switch and do the exact same thing on the opposite side again. Keep that back knee locked, bend the front knee, and let your pelvis sit forward until you feel it pull right into the middle of that stretch. Most importantly, again, take it just to the point where you feel it pull. Hold it there for at least 20 to 30 seconds and let that relax. Consistency is key with these stretches. Just make sure that you're doing them multiple times per day, at least 3 to 4 times a day, especially if you're sitting a lot, if you're in a long drive, or if you sit in an office chair, or you're on a computer all day. Make sure you're getting up and doing that stretch to loosen that up, because the tighter that gets, the more you're going to feel it in your lower back, the more you're going to feel that tightness in your hips and your pelvis there. If this is something you guys like, please give me a thumbs up. Please subscribe to our channel. We're going to be adding more tips and tricks and different things on sleep and everything else to try and keep you happy and healthy. Thanks, guys, and have a great day.